She did everything right. That is the part that stayed with me. She walked every morning. She watched her diet. She took her vitamins. She had annual checkups. By every conventional measure, she was doing everything a woman her age was supposed to do to stay healthy. And then, at 67, she was diagnosed with breast cancer. Her name was Patricia. And when she sat across from me after her diagnosis, the first thing she said was not, "Why me?" It was something far more devastating. She said, "I thought I was being so careful." I am Dr. Alan Miller, and after 18 years specializing in senior health and wellness, I have had this conversation more times than I can count. Women who did everything right. Women who followed the advice. Women who believed that the habits they had built so carefully over decades were protecting them, and discovered too late that one of those habits was quietly working against them in ways nobody had warned them about. That is what this video is about. Not the obvious risks, not smoking, not obesity, not a family history you cannot change. I am talking about something far more unsettling, a habit that is genuinely considered healthy by most doctors, most nutritionists, and most of the health media you consume every day. A habit that millions of women over 60 practice faithfully, with the best of intentions, and that the research is now linking to a measurable increase in breast cancer risk in postmenopausal women. By the end of this video, you will know exactly what that habit is, why the biology works the way it does, what the research actually says, and, most importantly, what you can do to modify your approach so you keep the benefits while reducing the risk. I am also going to tell you about 2 additional habits in this category that deserve your attention, because this is not a single-point conversation. It is a pattern. Before I go further, everything in this video is educational. I am not your physician, and nothing I say replaces the guidance of your own doctor. If any of what I share today concerns you, please bring it to your next appointment. Do not make changes to medications, supplements, or treatments without that conversation. Let me start with the biology, because without it, nothing else makes sense. After menopause, your body's relationship with estrogen changes fundamentally. Your ovaries dramatically reduce their estrogen production. Your body compensates, partially, through a process called peripheral aromatization, where fat tissue converts androgens into estrogen. This residual estrogen is lower in concentration than what you had before menopause, but it is not zero. And critically, your breast tissue, which contains estrogen receptors, remains sensitive to it. Here is why this matters. Estrogen, in the presence of breast tissue, acts as a growth signal. It does not cause cancer by itself, but it creates the hormonal environment in which certain cancer cells, particularly the estrogen receptor positive type, which accounts for roughly 70 to 80% of breast cancers in postmenopausal women, can proliferate more readily. Anything that elevates estrogen levels in a postmenopausal woman, even modestly, affects this environment. Now, with that biology in mind, let me tell you about the first habit: alcohol, and specifically moderate alcohol consumption, the kind that has been praised for decades as heart-healthy, socially beneficial, and, in the case of red wine, practically medicinal. I need to be very direct with you here, because this is where the research has shifted most dramatically and most quietly. The idea that a glass of wine per day is good for you, that one drink, consumed regularly, confers cardiovascular protection, has been substantially revised in recent years. The data that built that narrative had serious methodological problems, including a comparison group that included former drinkers who had quit due to illness, which made moderate drinkers look artificially healthier by contrast. But more specifically for our purposes today, even at low levels, alcohol raises circulating estrogen levels in postmenopausal women. The mechanism is twofold. Alcohol impairs the liver's ability to metabolize and clear estrogen from the bloodstream, which means estrogen lingers longer than it should. And alcohol elevates the activity of aromatase, the enzyme responsible for that peripheral conversion of androgens into estrogen in fat tissue. More aromatase activity means more estrogen produced. The research on this is not subtle. A large analysis pooling data from over 50 studies found that for every 10 grams of alcohol consumed daily, roughly 1 standard drink, breast cancer risk in women increased by approximately 7 to 10%. For postmenopausal women specifically, who are already in the highest risk demographic for breast cancer, this increment is not trivial. Let me tell you about Margaret. Margaret was 64, a retired teacher who came to me for a general wellness consultation. She was meticulous about her health, ate a largely plant-based diet, walked 6 days a week, maintained a healthy weight. She had a glass of red wine every evening, sometimes 2 on weekends. She had been doing this for nearly 20 years. Her cardiologist had told her the wine was probably helping her heart. Nobody had ever mentioned her breast tissue. When I walked her through the estrogen-alcohol mechanism, she was quiet for a long time. Then she said, "So the thing I thought was protecting me was also exposing me." That is exactly the right question. And the answer, for alcohol and breast cancer risk in women over 60, is yes. The modification is not abstinence for everyone. That is a personal and medical decision, but it is awareness. If you are currently having 1 or more drinks per night, this is a conversation worth having with your doctor, particularly if you have other breast cancer risk factors. Reducing to 3 or fewer drinks per week substantially attenuates the risk signal. Eliminating alcohol entirely removes it from the equation. Stay with me, because the second habit in this category is one that will surprise you even more. Vigorous, prolonged exercise without adequate recovery. I know. This sounds like I am telling you that exercise causes cancer. I am not. I want to be absolutely precise here, because this distinction matters enormously. Moderate, regular physical activity, walking, swimming, gentle cycling, yoga, is one of the most robustly protective behaviors against breast cancer that exists. Study after study confirms this. Women who exercise regularly at moderate intensity have measurably lower breast cancer risk than sedentary women. This is not in dispute. What is less discussed is what happens at the extreme end, specifically, high-intensity exercise performed at very high volumes without adequate recovery in women with low body fat can suppress estrogen so severely that it disrupts the protective hormonal functions the body needs, and in the process can also create chronic inflammatory states and elevated cortisol environments that affect immune surveillance. But there is a more directly relevant concern for the average woman over 60 who is not a competitive athlete. It is this: the pattern of intense exercise that drives significant, rapid weight loss in postmenopausal women can temporarily dysregulate hormonal signaling in ways that are not straightforward. And conversely, and this is the more common scenario, high-intensity exercise that is not matched with adequate protein intake and recovery accelerates muscle loss while failing to reduce the fat tissue that is the primary site of estrogen production after menopause. In other words, if you are doing hard exercise but not supporting it with protein and recovery, you may be losing muscle without adequately reducing the adipose tissue that drives postmenopausal estrogen. The composition shift goes in the wrong direction, and reduced muscle mass, independently, is associated with poorer outcomes across a range of cancer-related metrics, including treatment tolerance. Let me tell you about Dorothy. Dorothy was 69, and she had thrown herself into fitness after her sister's breast cancer diagnosis. She was doing high-intensity interval training 5 days a week and had cut her calorie intake sharply. She had lost weight, about 18 pounds in 4 months. But when I looked at her body composition data, the weight she had lost was almost equally split between fat and muscle. Her visceral fat, which is the metabolically active fat that drives aromatase activity most aggressively, had barely moved. She was exhausted, inflamed based on her CRP markers, and losing the muscle she would need to remain functional and resilient as she aged. The intensity of her effort was real. The outcome was not what she intended. The modification here is not to exercise less. It is to exercise smarter. Moderate intensity aerobic activity, 4 to 5 days per week, combined with resistance training 2 to 3 days per week, with adequate protein, at least 1.2 grams per kilogram of body weight daily, is the evidence-based approach that reduces visceral fat, preserves and builds muscle, and reduces the inflammatory and hormonal risk factors that matter most for breast cancer in postmenopausal women. Now I want to address the third habit, and this one is perhaps the most quietly pervasive of all: the routine use of certain supplements marketed specifically as menopause support or women's hormonal health products. The supplement industry targeting women over 50 is enormous, and many of the most popular products in this category, those marketed to ease hot flashes, support mood, improve sleep, and balance hormones, contain compounds called phytoestrogens. These are plant-derived compounds that bind to estrogen receptors in the body and exert estrogen-like effects. The most common of these are isoflavones, found in high concentrations in soy-based supplements, red clover extracts, and black cohosh formulations. In food form, edamame, tofu, tempeh consumed as part of a balanced diet. The evidence on soy isoflavones and breast cancer risk is largely reassuring, and in some studies, modestly protective. The picture changes with concentrated supplemental doses. At supplemental concentrations, phytoestrogen compounds can stimulate estrogen receptor-positive breast tissue in ways that food form consumption does not. Several studies have raised concerns about high-dose isoflavone supplementation in women with a personal or family history of estrogen receptor-positive breast cancer. The data is not yet definitive enough to draw absolute conclusions, but the precautionary principle applies, particularly because these supplements are often purchased without any physician involvement and taken long-term. Let me tell you about Barbara. Barbara was 66 and had been taking a popular menopause support supplement for 3 years. It contained red clover isoflavones, black cohosh, and a proprietary blend of herbal estrogen modulators. She had chosen it specifically because it was labeled natural and hormone-free. She did not realize that hormone-free and estrogen receptor active are not the same thing. When Barbara brought the bottle to her gynecologist and they reviewed it together, the physician asked her to stop the supplement and switch to non-estrogenic approaches for her symptoms: magnesium, cognitive behavioral techniques for sleep, and a dietary modification program. Barbara was initially skeptical, but 3 months later she reported that her hot flashes had reduced, her sleep had improved, and she felt more confident that she was not working at cross purposes with her own biology. The modification here is not to distrust supplements categorically. It is to treat them with the same scrutiny you would apply to a medication, because at pharmacological doses, that is functionally what they are. Any supplement targeting hormonal balance in a postmenopausal woman should be reviewed by her physician before she takes it long-term. Let me bring this together. 3 habits, all of them genuinely considered healthy, or at minimum benign, by most conventional guidance. Moderate alcohol consumption, praised for decades and only now being fully re-examined. Exercise without adequate protein and recovery, the effort real, the outcome sometimes working against itself. And phytoestrogen supplements, natural labeled, hormone-free marketed, estrogen receptor active in ways the label does not disclose. The women I have described today, Patricia, Margaret, Dorothy, Barbara, are not cautionary tales about failure. They are examples of intelligent, health-conscious women operating with incomplete information. The information they were missing was not obscure. It was simply not being communicated clearly enough. You now have it. And what you do with it matters. Here is your action plan. First, if you are drinking alcohol regularly, have an honest conversation with your doctor about your overall breast cancer risk profile before your next drink becomes your next decade. Second, if you are exercising intensely without a structured protein and recovery protocol, meet with a nutritionist or ask your physician for a body composition evaluation. Third, if you are taking any supplement marketed for menopause, hormonal balance, or women's wellness, bring the bottle to your next appointment and ask your doctor to review the active compound specifically. None of this is about fear. All of it is about clarity. Patricia, by the way, continued her treatment and responded well. We also had a long conversation, after her diagnosis, not before, about the habits that may have been compounding her risk. She wished we had talked sooner. She told me to make sure I had that conversation with every patient before they needed it. This video is that conversation.